Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Of course, the one story we're all talking about here in South Korea today is the fact that all operating hour curbs are being lifted on restaurants and cafes in South Korea as the government begins this living with COVID-19 scheme. People who want to use venues deemed as high risk, such as gyms, saunas and bars, will now need to show a vaccine passport to gain entry.
Yes, but with new virus cases remaining above 2,000 for a fourth straight day on Sunday, could the easing of restrictions only exacerbate matters as the winter begins to set in? To get the answer to that question and more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, doctor.
Good morning.
Now, first off, what's your opinion on the specifics of the government's plan and how effective it'll be and the timing of the rollout?
You know, in terms of the timing, my personal preference would have been to wait until we had more than 85% of the population fully vaccinated. And that's just based on what happened in Singapore. They have greater than 80%. Now it's 84% of their population fully vaccinated, and yet they had their worst day of COVID just a few days ago. And so based on what's happening overseas, I think I would have preferred until 85% of the population fully vaccinated and perhaps more than 50% of the vulnerable population having received boosters. I think would have been a safer time to engage in the living with COVID measures. In terms of the specifics, you know, now that we're living with COVID, I think the opening up of society is going to be much more geared towards people who have been fully vaccinated by use of the vaccine pass, as you mentioned. One worrisome aspect of the guidelines as stated right now is that there's no hard endpoints for when we would be triggered to go back in terms of pulling back if it looks like it's unsafe. The numbers that were stated was daily caseload, 7-day average, rolling average daily caseload of between 3,500 and 4,000 a day, and also greater than 60% hospital occupancy at the designated COVID hospitals. But in my opinion, it's only going to take a few weeks before we get to that level. And then for the stated guidelines, it said that they would convene an emergency meeting at that point. It's not that they would actually pull back. In terms of the effectiveness, you know, the fact of the matter is if you have more transmission, then you have more chances of developing mutations. And then with more mutations, you have more chances of developing a variant that will become dominant, again, just like the Delta variant became the dominant strain. And so I'm concerned with what's going to happen when we have more transmission in Korea.
Now, as Won-jong was just talking about before, officials are now only, or focused more heavily anyway, on the number of daily hospitalizations and deaths rather than overall cases, and broaden self-treatment for younger, healthier patients who only have mild symptoms. What do you think is the reasoning behind this change?
Well, obviously, people who are young and healthy and who get COVID, a lot of times they're completely asymptomatic or have only mild symptoms. And so we don't need to overburden the healthcare system with 24-hour medical monitoring of these very, very low-risk patients. And given the fact that we're anticipating an increase in the caseload, we've made the decision that we should keep people who are young and healthy, asymptomatic at home, and just do remote monitoring for them so that our healthcare system does not get overburdened.
And also, several nations that already rolled out living with COVID-19 schemes, such as Singapore and Russia, and a few others have had to reintroduce restrictions because they subsequently saw fresh surges. How likely is this to happen here as well? And if it does, do you think South Korea's response would be the same?
Well, you know, Korea has very high compliance with universal masking. I think almost 100%. You know, if you look around the street, you can hardly find a person without a mask on their face. On the other hand, Koreans have a tendency to do things in groups. That's the preference. And so there is a very high chance that once restrictions are lifted, that the case numbers will start to increase dramatically. And as I mentioned, there are some soft measures for when we would pull back. But, you know, historically, it's always taken a good several weeks for us to see calm COVID numbers after restrictions are implemented. It takes weeks to months to get back to baseline. And so that's what I'm concerned about, is just these very large lag times to get back to normal once we pull back from high levels of transmission.
Yeah, it's funny you mentioned that the mask wearing is like 100% in South Korea, because I honestly think I've never seen a person outside in South Korea without a mask on. But finally, before we let you go, living with COVID-19, just by that mere statement alone, suggests the government knows that COVID is going to be around forever. There's going to be outbreaks occurring every so often, much like influenza, no matter how many vaccines come out down the road. Do you believe COVID-19 is endemic worldwide and this virus will never be totally eradicated?
I think so. I think that it's pretty much spread out around the world so much that it can be considered an endemic disease. I think that there will be what we call antigenic drift. In other words, there will continue to be mutations such that at some point our current vaccines will need to be updated in order to give the same level of protection. And this is the case, as you mentioned, with influenza. So we may have to, unfortunately, look forward to another booster or an updated vaccine sometime in the future. We're not exactly sure of the timing of that yet. We're still waiting for optimization of vaccination against COVID-19. But I do think that this is something we're going to have to deal with for many, many years, especially given that it's going to take at least another 1 to 2 years for us to get the level of vaccination out in the global community for everyone to start to feel safe again. We have to remember only 4% of people in middle and low income countries have received the vaccine. So we have a long ways to go.
All right. Dr. Tan, thank you as always for your insights. We appreciate your making room in your schedule to come on. Thank you so much.
Thank you.
That was Dr. Alice Tan from Internist at MizMedi Women's Hospital.